Hey, what's up? This is MDUP episode 2, and we are your hosts, Ankoor Bhattacharjee, Fractal Biomechanics on Instagram, and
I am Shaun Astorga, AMP Education on Instagram. I forgot the name.
So on this episode, we discuss a lot in depth about the rib cage. So let's first start discussing about zone of apposition. So Shaun, let's talk about zone of apposition, ZOA, and how important is it when it comes to training and rehab?
Yeah, so the zone of apposition. So by definition, it's the area of the rib cage that opposes the diaphragm. So if you think of my hand here, hopefully you're watching, as the diaphragm, right, as it domes up, the better it is at doming, the more area of the rib cage you're going to have that opposes it versus a flatter diaphragm, the less area you're going to have that opposes it. So why it is important is the ability for us as humans to demonstrate variability in our system, right? Our movement system and any other system, to be honest, can be influenced by maximizing or optimizing how much of the diaphragm is actually opposed by the rib cage. So getting into what we would call like a more of an exhaled state at the rib cage.
Yeah. So if we talk about ZOA, someone who is, you will see people with chronically activated SCMs, like neck muscles, SCM, scalenes, and all.
Yeah, they call them literally. People will call them like neck breathers. Yep, exactly.
Yeah. What happens with the neck breathers is that the rib cage as a whole goes up, is elevated, and because of that, the diaphragm does not have that much of surface area around the rib cage. So the ZOA is reduced. And when the ZOA is reduced, you cannot breathe in a way where you get front to back expansion in the rib cage, because the rib cage is already elevated using the trap neck and trap. So restoring ZOA using a good complete exhalation will slowly bring the rib cage down, dome the diaphragm up, and create that zone of apposition. When you have that, you will increase your shoulder and hip mobility, which will give you a lot of movement options in the body. So for example, imagine this. Just act like you are a massive neck breather and try flexing your shoulders. Uncomfortable, right? Now try exhaling and getting the ribs down. See how much difference it creates. So this is exactly how the human body works. So if you have good ZOA, your movement options will be higher, period.
Yeah, and if you just think of what needs to happen when you breathe in and breathe out, right? When you breathe in, you need to expand. So your rib cage needs to literally get bigger in all directions. And then when you breathe out, the opposite is true, right? You move towards the ground, so everything compresses. When you have a smaller ZOA, right, or like a flatter diaphragm or a diaphragm that can't dome, you're limiting the ability for the rib cage to expand and compress. It's only going to be able to expand in that scenario in the lower ribs, right? So your lower ribs, that's where you get like your rib flare, right? You'll see someone kind of like hinge or extend at their back or their TL junction, right, their lumbar spine, wherever. And like you said, you're going to see the whole rib cage kind of move up and down as a unit versus being able to expand like it's getting blown up like a balloon.
Yeah. Talking about rib flare, why does that rib flare happen? Because if your rib cage cannot expand front to back, air has to go somewhere, and because of that, the easiest place where the ribs can be bent or the shape can be changed is the front lower ribs. If you see helix behind Shaun, you will see that the ribs, that surface area of the lower ribs is mostly cartilage, right, Shaun? Like where it can,
we're talking this, doesn't it? It's not a direct attachment to the sternum, right? Like where these are kind of directly attached. This is attached by a long piece of cartilage.
Long piece of cartilage, and that is much easier to bend, and the shape can be changed compared to the bone. And that is why you will see people who have this flared ribs, because over a period of time, the cartilage has changed shape and has flared, like come up this way. So that is how it happens.
It's not just the air though. It's what Dog's my bark. It's what happens with where the air goes, yes, but it also going to push the organs. It's going to push internal fluid, everything. So a lot of pressure is going instead of going
forward, downward.
Down is going forward and downward. So you're going to get a lot of force right over time that is going to cause the anterior ribs to change shape.
Yeah. So let's talk about the role of obliques and serratus anterior when it comes to increasing ZOA and increasing movement options and how it impacts the ribcage.
Yeah. So your obliques are going to be what anchors the lower ribs, so that when you take a breath in, right, the ribs can expand and spread like we as we described. You're going to have a situation where your obliques are able to help control the top part of the pelvis. So they're going to help assist in what we would call like a stack or tucking the hips. They're going to help gain leverage so that when you exhale, right, they can take the lower ribs and move them right down, back and in. And that's what's going to allow us to, when we take a breath in, keep that the control of those muscles, keep it, they call it eccentric ab control. When you take a breath in, it anchors the bottom of the rib so that everything can kind of expand and you can get a nice kind of pressure gradient moving up and downward in the system.
Yes. So if you see the attachment points of the obliques, you will see it's in the lower rib cage and it's at the pelvis, at the top of the pelvis. So because of that, what happens is, suppose you are someone who is exhaling properly in a stacked position. By now, I hope you know what is stacked, when the thoracic diaphragm, pelvic diaphragm kind of parallel to each other in three-dimensional space. Now, what happens because of that is when you exhale properly, you'll feel subtle sensation in the lower rib cage. Those are the attachment points of the obliques. And if you do it right way, if you do the posterior pelvic tilt in the right way, you will feel subtle sensation at the side lower region in the abdominal wall. Side lower, not the rectus, side lower. Subtle sensation, lower rib cage, side lower abdomen, which means both the attachment of the obliques are on. Now the rib cage and pelvis are stacked, which means if you have exhaled, the zone of apposition is there, diaphragm is domed. Now holding on to that subtle sensation, if you can inhale, slow and silent, you will feel the rib cage expand front to back. Because now the neck muscles, back muscles, straps are not involved. They're like minimal involvement. So they're accessory muscles, not main muscles. So now you'll feel a lot of front to back expansion, and that is the role of obliques, to keep the ribs and pelvis anchored so that you can expand your ribcage front to back.
And you said a word there that's very important, because it's where a lot of people kind of mess this stuff up. You said subtle. You'll feel a subtle sensation, because it gets very confusing when you actually are starting to chase the sensation, because then that's when you're going to see people start to do crunching. You're going to hear people on the internet say you could just do like grab a kettlebell and do weighted side bends because you're feeling your obliques. And that's fine, but that's different, right? That's a different goal that you're going for with that. What we're talking about here is something that is restoring the zone of apposition, restoring the movement options and changing how your body manage pressure. So they're very, very two different things. And where a lot of people go wrong is they use a lot of tension to get into these positions. So when they tuck, they forcefully crunch their body, they lose height in their body. And if you just think about it conceptually, like from what the word expand literally means, it means get bigger. If you are crunching your body and you're losing height in your body, your rib cage is getting smaller, You're just orienting everything and moving it in one direction. So that's an important distinction when it comes to the execution of some of the stuff that we're talking about.
Be position and sense driven, not muscle driven when you do the breathing drills, because that is where the biggest mistakes happen. You are forcing the sense and you will end up doing things which will result in you getting nothing out of the drill.
Yeah. Anytime you see somebody like say they're standing in a split squat and they go to tuck their hips and you see their head jump forward in space, that is already, you're not tucking at that point. I don't know what you're doing. You're just crunching your body down, versus just driving the force from the ground and how you put your pressure into the ground and letting that go up the chain and kind of bias the positions that you want and load the tissues that you want. Very, very different things.
Yeah. So if we talk about front to back expansion, let's talk about what true rotation means. We have a lot of thoracic mobility drills and rotation drills available on the internet, but what true rotation means, because there's a big misconception. Just because you are
Turning. Yeah.
turning and seeing the other side, left and right, does not mean you're truly rotating from the rib cage. So, Shaun, if you could visually demonstrate.
Yeah, of course. So true rotation can be, I guess, described as one side compresses, the other side is able to expand. So there's actually a change in the shape of the rib cage that happens. So the situation you just described, where like someone just kind of like turns their body and nothing moves. If I show from like the top down, I don't know if that view's okay. That's the equivalent of just doing this. So you're just kind of like twisting at the spine, right? There might be a little change in what happens at the rib cage, but it's primarily coming from spine movement, versus getting a situation where you have one side that compresses. So in this instance, this is the side that's compressing and the posterior aspect is expanding. Then the opposite is true on the opposite side. So you'll have an actual shape change.
Shaun, if you could hold on to it.
Oh, yeah.
So viewers, look at this. Viewers, look at this. Shaun, if you could show a right turn. Yeah. So see this. In order to get a right turn, divide from a top view the rib cage into 4 quadrants: right, left, up, and low. So in order to turn right, your right back needs to expand and right front needs to relatively compress, and the opposite for the left rib cage. So in order to turn right, your left back needs to compress and your left front needs to expand. And for a left turn, the exact opposite, diagonally.
Yeah, the exact opposite. Yeah, exactly. And what that means is you're shifting airflow and your organs and fluid in your body into those areas that are expanded. That's what's allowing the turn. That's not saying, yes, I can acknowledge that this is me turning my body, but that is a different than getting the rib cage positions that are actually, I'm gonna use the word optimal. People don't like that word, but whatever. Like you're maximizing the ability to like use energy and store energy in those situations versus just turning your body as a unit.
The relative position of the spinous processes, I would say, remain kind of unchanged when you are just turning for the sake of turning. Whereas if the rib cage is expanding, the discs, with respect, that is relative motion. With respect to each other, they will be moving.
Like they're going to move. Turn. Yeah, and we have some posts on our AMP's Instagram that demonstrate this, what it looks like when you have like more bias towards rotation, like a truer rotation with relative motion versus orientation. Because once you see it, you're going to see that like when someone's not being mindful of where they're compressing and expanding, that what happens is they create hinge points at their body, right? So like their transition zone. So your lumbosacral junction, TL junction, right? Your CT junction, wherever it might be, is where the twist is likely going to come from, versus getting more of like a gradient of motion kind of up and down the chain.
Yes. And as we are someone who practice breathing drills and do it on clients, let's debunk the myth where people say that people who practice breathing drills are like, extension is bad, like extension is evil. Like they have this notion that we preach as if extension is bad. So what are you going to say about that?
I don't know where the myth started, but I will say no one's saying that extension, like at least we don't think that extension is good or bad, right? Where it becomes problematic is when your body is in a state of extension and everything you do, right, relies on extension range of motion, but you're already there, so you don't have a lot of motion to kind of move into, and you can't go in the opposite direction, right? So that's when you run the risk of like certain tissue getting irritated or pressure staying in one area or not having a lot of movement options in your system. It's not that extension is bad, it's that if that's your only option to move, then you're probably leaving some room on the table from a performance standpoint, and potentially that's a mechanism of why someone might have focal loading in their body that leads to a painful experience.
Yep. Imagine a vertical jump. Imagine Cristiano Ronaldo, like vertical jump. If you have to vertical jump like to the max, of course you need extension. You cannot be like loosey-goosey at the top of a vertical jump. You have to be stiff and extended at the top of a vertical jump in order to head the ball. But imagine, so this is where extension is like you're back muscles are all like shortened, chronically shortened spinal erectors and lats and everything. Imagine if that is your state when you are on the ground. Will you be able to jump that high if you're already chronically shortened in those muscles? Will you be able to jump that high? No, you won't be. It's only when you are, you can only contract when you are eccentrically oriented. Like if you have this, only you can go this. If you're already this constantly, how far can you go? If you're this, you can go this. So this is very important for people to know that you need movement options. The greatest athletes, they change shape at any given point of time when the task requires them to, and that is why they are greatest athletes. But yes, as Gen Pop, normal humans, we need to have movement capabilities so that we do not focally load certain tissues all the time.
Yeah, and it's what was I going to say? Oh yeah, like it goes to another misconception or thought that people have in this subject is that if you take away like that we have some special skill where we're going to take away someone's athleticism because we we move them away from
God gave them
right, like we're moving them away from this like extension bias that makes them like good at their sport, whatever that means. And that's like just it's a misconception, right? Like by giving someone more movement options, you're going to allow them to express what they're already very good at in a way that like probably in more a number of different ways, right? Versus like the one strategy that they might have. And it's definitely a misconception. And the goal is not, again, it's not saying it's bad, right? Like you would probably want like an elite sprinter or anyone who sprints to have like giant anaconda looking muscles on their back, right? You want that, but you're definitely not going to take it away. But I can tell you, as someone who has like worked with people in every sport you could think of, even at the highest level, who have pain, right? Managing the principles don't change. We're still managing their center of mass. This also goes to the notion that, the misconception that breathing drills are too low stimulus, right? For these big, strong people. It's like, no, it's just how people approach them is probably not appropriate for these big, strong individuals. And there's no one I have ever met that does not get a gradient of motion back from a breathing drill. Like, I don't care how big and muscular you are, you may have to like tweak how you do it. You might have to use some like hands-on stuff to help them get into the positions a little better, but the principles are the principles, right? And when you appreciate that, right, then these misconceptions start to like make a lot less sense.
True. The role of serratus anterior.
Serratus anterior, yeah.
When it comes to ZOA and ribcage mobility.
Yeah, so think of serratus anterior. People think of the motion on the scapula, right? So it protracts, upwardly rotates the shoulder blade. But when you actually look at like a picture of your serratus anterior, I posted a picture of it today announcing that we were doing this. So I'm waiting for 5 hours while you're getting your juice. No, just kidding. But what, like the serratus takes up, it's literally on every single rib, right? And the line of pull is such that it changes, right? So it has an external rotation bias, right, towards the bottom, and an internal rotation bias up toward the top. So just from that alone, right, you can influence with a reach of your arm to influence the position of the rib cage and what areas you're going to compress and what areas you're going to expand. The upper fibers internally rotate. So when you're reaching in this position, right, you're going to bias expansion on the front side of that body. That's going to turn you right contralaterally. So it's going to turn you toward the opposite side. So if I'm reaching my right arm, it's a bias towards a turn to the left. You can also have a reach, right, where you're reaching and your rib cage is retracting. So your rib cage is moving backwards on that side. That's going to be you're biasing the lower serratus fibers to turn you toward that side. So you can influence, right, using the arm reach and combine that with the exhale, the position that you put a person in to optimize or maximize, I guess is the word, maximize the ZOA, the exhalation capabilities of the person, and get them turning in the direction that you're trying to reintroduce a turn into their body, whatever the goal might be.
How to progress from breathing drills to force production or gym stuff using ROM as a KPI?
Yeah.
So if someone is injured or someone has chronic pain, so using ROM, range of motion, as KPI, and how to progress that way.
Yeah. So when I think about the breathing drills, I almost think of them as a we're putting a person in the best position to be successful. So we're going to probably be eliminating gravity, but it's success meaning that they're able to start introducing force production. So when your body is touching the ground, whether it's your feet, you're laying on the ground, you're introducing a level of internal rotation, right, to the situation. So you're introducing force production. So you can train a person starting from the ground up in with that mindset, right? So when we're talking about using range of motion, the easiest to see, I think, are like shoulder and hip flexion, right? We want to measure, or even straight leg raise too, but right, we want to use, if we're thinking about training a person to maintain the joint range of motion, we can use a respiration drill to restore some shoulder flexion, right? So to reduce anterior orientation on their body so that they get some rotation back in their system. And then we can scale that from the ground, from a breathing drill, which would be on the lower threshold side of things, up to higher force production type activities. So what would that look like? It might look like somebody who's has decreased internal rotation in their shoulder, right? And they have limited shoulder flexion in their body. So this is a situation where we have center of mass, right, is biased towards being forward. We use a breathing drill and we restore their ability to expand the front of the rib cage, the back of the rib cage, and they get internal rotation back and they get a lot of shoulder flexion back. They're a field athlete. So we can incorporate this into something like a skip by making sure that as they are skipping, that they're actually taking their elbow through the ranges of motion that are necessary in order to keep the pump handle or anterior chest wall open. Same thing goes with like your strength training, typical strength training exercises, right? If your goal is to maintain a certain area or range of motion, it makes sense to work within that range of motion in an RPE that they can maintain and that they can perform while managing gravity. Because the goal becomes then, is like, can I put them in these positions that are going to allow them to be successful? And it's all the same, right, when it comes down to it.
Yep. True. Like
pressure management, man. It's pressure management, right? It's like where do you want the airflow to go? Where do you want their center of mass to go? Where do you want them to turn? Because then when you think about it from that perspective, it's not like, oh, I need to bias all my bicep curls for posterior expansion. It's like, why am I biasing a bicep curl for posterior expansion? Is a better question, you know? People get silly with this stuff.
Yeah, I mean, if you're in pain, so we have to take, so you cannot be doing whatever you like when you're in pain. So you have to take, you have to consider range of motion, relative motion between the joints and all, and your programming, load management, whatever it is, so that we can distribute stress better uniformly between the tissues so that you can get out of pain or eliminate or manage whatever it is. So it's not that you always have to play within that ROM. If you're healthy, not in pain, you can. Probably it won't affect you, but over a period of time, the cumulative focal load, if you do not have other movement variability, then probably it might affect you. It might, we don't know. But yes, if you're in pain, focusing on relative motion, RPE, rib cage mobility, that would be really helpful. And I mean, getting the center of gravity backward, working towards working in the range of motion that you have access to would be a safer thing to do, depending on, of course, how severe the pain is. A case by case study, case by case scenario though.
Yeah, and you have to define a goal, right? Like there has to be a goal attached to it. My goal is like I'm a distance runner, right? So all my strength training is really focused at keeping the qualities that are going to allow me to run long distances, right? So everything for me is managing center of mass, maintaining muscle mass, right? And being able to like not fall into this position and get like cervical symptoms and that kind of stuff. So when you think about it that way, it's like my ability to keep my pump handle up in higher levels of stress, right? And build capacity in those positions. Like that's what we're talking about, right? It's not really it's not different from what people typically think of as training. It's just the execution of these things is different. The perspective is what is different.
Yeah, absolutely. Awesome. That was incredible chatting. And I hope the viewers will learn a lot. It was a short, crisp, to the point episode that people will learn about why ribcage, why ZOA is important, why ribcage mobility is important, what is rotation, why certain muscles are really crucial while getting ribcage mobility. So yeah, fantastic episode. Yeah, we will release another episode in the upcoming week.
Awesome. Encore.
Awesome.
Thanks, man.